The following half-hour show is a paid political program and is not endorsed by this station, management, or staff.
The following program is sponsored by Excalibur Insurance Management Services.
This week's guest, Dr. Justin Matus, PhD, will provide an in-depth analysis of the current pandemic situation as we begin to emerge from the dark shadow of COVID-19. Dr. Matus had appeared on this show last spring, you may remember, while we were in the middle of the complete lockdown, which he was against. Now, a year later, we have the benefit of hindsight. You may remember Dr. Matus has achieved the highest distinction of being a fellow in the American College of Healthcare Executives with over 30 years of experience in healthcare policy. He had served his country as a lieutenant in the United States Marines. After 3 years, he was transferred to the United States Navy and received an assignment to a fleet ship, the USS Wasp, where he served as the director of the ship's medical department. After his military service, he was asked to serve at the United Nations, consulting during the Yugoslav conflict during 1994 to 1995. He has appeared frequently as an expert in the national media, including appearances as a health policy expert on NBC Nightly News. Dr. Matus holds a PhD in Health Services Research from Old Dominion University and holds an MBA from Golden Gate University, San Francisco. He is also the editor of the Transnational Journal of Business and an associate editor of the International Journal of Health Planning and Management. And we look forward to his opinions and comments today as we attempt to emerge from this pandemic.
This is the Volpe Report, a weekly news and political interview show examining the latest local, state, and national issues with Chuck Volpe. Insightful, informative, controversial. The area's premier political talk show, the Volpe Report.
Doctor, welcome back to the Volpe Report.
Thanks for having me, Chuck.
You know, as we were talking off camera, I'll remind our guests, you were last spring when the world was coming apart, it seemed. You were one of our most important guests. We dealt with the pandemic head on. I spent a lot of time dealing with our governor's response to the pandemic. I was extremely critical of him, have been to this day on other matters, but you know, a lot of what you had said, you had predicted, you had press conference and the like, that this wasn't the right way to go about it, and your comments on that.
Yeah, thanks, Chuck. Well, yeah, it's been an interesting year. Looking back on where we've been and where we need to go, my biggest fear continues to be that aside from the victims and those that have passed away from COVID and their families that have been affected by it, is that public trust has been compromised. Trust in the medical community, trust in the public health community.
The scientists? Yeah,
and I think, unfortunately, the whole debate quickly devolved into this political finger-pointing that absolutely served no one. And we could argue whether, well, he started it, she started it, but I would, I guess, respectfully chastise both sides for, frankly, getting in the way of the science at many levels. And speaking of levels, and our governor, and so whether you want to kind of zoom all the way out to the White House level or down to the local level, I'm of the opinion that probably the biggest mistake was to not trust everyone, including our local experts. I mean, who would know better how to manage a patient population than a family doctor, for example?
Of course.
And I think that's evidenced by what happened once the vaccines started hitting the streets. And they discovered that, oh, you know, there's an extra dose in there. Well, thank God some bureaucrat didn't get in the way of common sense and good judgment, say, hey, let's grab that cameraman. We've got an extra dose. Do you want the immunization? And we gave it. And
right.
So there's a lot of lessons to be learned. And I think we still need to really think about not only where we've been, but what is the end game? And I think there's still a lot of important questions that we need to ask ourselves about the end game.
Yeah, and there's so much, you know, the other issue that really hadn't completely manifested itself in the time of our show it was only in weeks after that and shows after you appeared last spring, we didn't know that how bad the crisis in nursing homes were. Another specific example.
Oh yeah.
And how disastrous the policies were. You know, I think I used the term petri dishes. They were never, there was never any government involvement or health department involvement in a protocol for how guests would be allowed to come in, sanitizing it to begin with, giving it like effectively cleaning it and sterilizing it and swabbing it down. None of that was done. And at the same time, the governor is ordering COVID positive patients that they had to take, which was, you know, I'm not a doctor and a scientist, I'm a lawyer, but sometimes the eye test just works too. It just doesn't even sound right. And of course, getting back to, I guess, the point of that is that while everything was shut down and they were, quote, using the science of the positive patients and the deaths to determine it, in northeastern Pennsylvania alone, in this whole corridor, Doc, 83% of the deaths in June were nursing home or senior centers. Mm-hmm. So why is everybody else shut down? I mean, that's just one example of what you're talking about. I mean,
yeah, and at some level it continues. So now one of the interesting talking points is, so if you've been vaccinated and we're telling people that the vaccine is, pick your percentage, 90% effective, 95% effective,
right,
or
right.
even if you contract COVID with the vaccine, the symptoms will be far less severe, right. 100% survivability, knock on wood so far. Right. So there's just a lot of policies that frankly don't line up, or at least don't line up for me. And I keep going back to credibility and give people the information and let them make the decision what's going to be best for their situation. And obviously, again, work with their healthcare professionals, their doctor, their medical clinic, their health system, to make informed decisions.
One of the issues that you raised that's interesting for me, and I've always viewed this, and I have the greatest respect for science and scientists. Like all professions, lawyers, doctors, scientists, and the like, there's some very, very good ones, and there's some not so good ones. That happens. But if we've learned anything in getting back to science, that it seems to be an evolving discipline. And by that I mean, yeah, there's some empirical facts. Clearly, we understand across everything. But the interpretation of those facts, Doc, are done by human beings, which are whom are flawed, and myself included. We all are. And to make life and death decisions with the certitude that they made those decisions, and then have to retrace their steps. And I'm not going to sit up here and blast Dr. Anthony Fauci, although I believe he's in line for a certain amount of criticism, because of getting back to your point. First it was this, then it was that, then not so much, then back to this, and then it was that, and then not so much. And again, so to inspire confidence in people, to your point, there was never any allowance for a give and take with people, letting them make some of the decisions.
Yeah, absolutely. And I think no matter what side of the aisle you sit on, I think in fairness, if you look back to this point, how quickly, immediately it became a political discussion, not a scientific discussion. And what is done, as I said, is not only kind of shaken our core belief in science and the scientists, whether it's Dr. Fauci or anyone from the healthcare community, including myself, and I'm sure there's people who are going to be out there and say, well, he doesn't know what he's talking about, and I'll accept those criticisms. But this politicization of the problem of COVID and the challenge of COVID. Look what's happened. Now, the wearing of a mask, the decision at the individual level has become not so much a medical decision or a belief in their own health status, but it's become a political statement, and sometimes foolishly. I mean, there's people in the high-risk groups who absolutely should be the first ones trying to get a shot, and the ones who should be the most observant about wearing masks.
Of course.
But it's like, well, no, I'm going to stick it to Joe Biden by not wearing a mask.
Right.
That's silly.
That's
silly.
Right.
And that concerns me.
Yeah. A lot of this seemed to be ideologically driven in many cases, and that also seemed to be. It seemed like the Democrats in the Democratic states proceeded one way, the Republican states proceeded another way, and you know, honestly, right now, I think some of the most strict states, including Pennsylvania, I don't think history will be kind. When you look back right now, and let me give you a couple of numbers here. Let's start with the four larger states, basically, and it breaks down neatly. You have Texas and Florida, and you have California and New York. Yeah. Texas and Florida have Republican governors. They adopted a policy that was much more open, let's say. In fact, there were not the strict shutdowns. There were certain things you had to do, of course.
Right.
It wasn't a free-for-all, the Wild West, but it was pretty much open. They didn't, and the result of that, you know, if you look back at the numbers for a year, they're both in Florida. I'll start with Florida. They're a little better than the average median. They're you know, so some will say, well, they're not in the upper echelon. They're right in the middle of it. Yeah, but they're right in the middle of it, having been open. Yeah. Versus people that are worse in the middle of it and having been, like, then you look at New York and California, and again, interjecting politics. Back to Florida and Texas, but Florida, their governor, Ron DeSantis, is right now the front runner for the Republican nomination because of the popularity. He's not just in Texas. He was just asked to speak at a big gathering in Pennsylvania. He's traveling the country. He's looking like a candidate, but kind of basking in what is believed to be a correct handling of how he did it. Then you have to look at the other two big, happen to be Democratic states. California, there's a recall for Governor Gavin Newsom. They have 1.6 million signatures, and right now the smart money is he's going. Yeah. And then you look at New York with Governor Andrew Cuomo, who was the darling of the media, had a best-selling book, somewhat of a coronation, and right now he's under criminal investigation by the Justice Department. There are calls for impeachment by both parties. In fact, in my time, I'm not sure I've ever seen a fall from grace from the high point he was at to where he's at now, under siege, basically. Now there's all the sexual issues that are coming up, sexual harassment. So you look at, you know, how those things work. You know, as I said, from my standpoint, because on this show I've been a proponent of be open and be fair, and I'm going to let you comment now. One of the issues, you remember, you and I talked about, all the businesses in Pennsylvania, our governor, by the way, ranked 46th out of 50 in poor performances in COVID as well. Shut everything down, destroyed the economy. So again, back to what we had said last year, you were a proponent saying, don't do that. And you talked a lot about herd immunity. Well, right. I posit this to you. One of my criticisms all along, if you have everybody shut down wearing 3 masks and locked up in their house, how are you ever going to have herd immunity?
Right, yeah.
And then in September, when they finally let people out, we had a spike. Well, no kidding.
Right, yeah.
But go ahead, take it.
Well, no, you're right. I mean, you gain nothing on the problem, and I mean, there's, in some ways, there's so many places. Where do you start?
Wherever.
Herd immunity. The other one, go all the way back to the beginning. Remember that the narrative was flatten the curve.
Right.
And we went from number of deaths. That was the headlines, right? But then as the deaths kind of weren't as interesting, or the numbers weren't as, I guess, overwhelming, and they just didn't grab a headline. So then all of a sudden the narrative shifted to new cases. Now, again, that is a measure of how the disease is progressing and moving throughout the population. But I don't think we could have this conversation, politics, and without also talking about the media and their role in this whole.
You mean fear-mongering and scaring the heck out of everybody?
Well,
you mean that?
I'm not going to label it in any particular way. I'll let you do that. But it certainly wasn't helpful at times. And I wish if their mission, their goal was to give information, they would give complete information. But I want to go back to this conversation about the White House, the governors. I was thinking about this on the drive over, anticipating, looking forward to another chat with you, of course. But I had this thought that, you know, if I were king for the day, if we could go back in time, I wish we could have gotten the White House and the Congress to say, let's agree on a bipartisan task force to develop the policy. And then you governors implement it. We had just the opposite. We had 50 governors trying to make policy, but not necessarily concerned about implementing it.
Right.
And anybody can come up with a great plan. Have you ever tried to go out and execute a plan?
It's hard.
Yeah, and again, to use
hard.
my military background, we would always say a poor plan, well executed, is much better than this elegant plan that's poorly executed.
Exactly.
I think there's a lot to learn. And the other thing I want to remind people about is in the short-term versus long-term effects. So in the immediate sense, obviously, if someone contracts COVID and they die, that is the worst possible outcome.
Right.
But we've also made trade-offs, not just economic trade-offs, but health trade-offs. So the consumption of alcohol has increased during the shutdown.
Right.
That's not an opinion, that's a fact. Long-term effects, we still don't know. Depression, suicide, alcoholism, drug abuse.
Everything's up.
Different routine medical exams, colonoscopies, mammograms, all those routine things have all now been pushed forward and continue to be pushed forward. We are gaining that ground back, but some of that will be unknowable. And I think that's the other, you kind of alluded to it, and I wanted to talk to that point as well about this. We humans were not perfect, yet we have this desire, this just visceral need for certainty. I want to know yes or no. Well, life is messy.
Yeah.
and there's a lot of ambiguity out there, and there's a lot of stuff we won't know, or it's just unknowable, or at least unknowable in the short term.
Right. The other thing, Doc, for me is that, it's a cliche that, we're all unique. For example, no one has the same fingerprint. That's why they use it to identify people. Well, no one talks about it into a deeper sense. Let's talk about physiology. Everybody's physiology inside is different. I mean, why do some people are more prone to developing certain types of cancers and others living in the same environment and it don't? Why do some people produce too much, let's say, cholesterol, and then that leads to heart disease and heart attacks, and others have no problem? I mean, so, again, not being a scientist, but just common sense, if everybody's different, our physiology is different, and I know that that type of virus is serious, and it's going to do certain things the same way, but human beings' response to it are going to be as unique as each individual, and some of what, to your point, is that's why to a one-size-fits-all approach
took the words right out of my mouth.
It's a disaster.
It took the words right out of my mouth, and there's a lot of discussion about, well, can we make the vaccine mandatory? Well, good luck with that, because I've seen, I'll take my word at it from the national media and online. Different universities and colleges have announced they're going to have mandatory vaccine requirements.
I've seen it.
To
They're
return
requiring it to return to
classes.
class.
Yet I've read legal opinions that says you can't do that.
Can't. I'm a lawyer. I mean, now you're to my jurisdiction.
So
can't do it.
So please ask me if you can make it mandatory. My answer is I don't know, and I'm very comfortable saying I don't know. On the other hand, I would say this: if someone were asking me for their advice about making the vaccine mandatory, would you do? I would say absolutely not. And you would get more compliance if you just, again, gave the people the information.
And let them make the decision.
Let them decide. And, you might have some measures like, okay, you don't want the vaccine, but we're going to ask you to wear a mask when you go to class.
Right. Okay.
Okay.
That's a reasonable restriction.
Yeah.
Which the law allows for.
Right. Yeah.
You can't take away the constitutional right, but the government and the state has a responsibility that they can place reasonable restrictions.
Yeah.
And I won't get into too far in the weeds. There's different standards of restriction based on the threat, of course. So
and I think it goes back to not only individual control and control over your own destiny, but that decision making at the local level. Let the local college decide, let the county commissioners decide, and we saw how that went. It did not work out well for some of our county, our friends in other parts of the state where. I guess we both remember where the county was trying to opt out of some of the state's mandates, and they were beat up for it, unfortunately.
I think they were up to 12, maybe as high as, at one point it got to 14 or 15 of the counties did just that. We're not listening anymore. So, Doc, we're going to take a quick break.
Great, yeah.
We're here again today with Dr. Justin Matus, a renowned and national expert in health sciences, as you're hearing him talk about today. And we'll be back right after these messages.
Every week, Chuck Volpe shares his perspective on Pennsylvania issues in the news and on your mind. From new laws being introduced in Harrisburg and Washington to government spending and even local controversies, hear how they affect us in Northeast and Central Pennsylvania. Catch Volpe's views every Tuesday on the Fox 56 News, first at 10.
Welcome back. Again, we're here today with Dr. Justin Matus, a renowned expert and national commentator on some of the issues we're talking about today, as you've heard in his bio. So, Doc, let's talk a little bit about an observation you had made that big pharma, for lack of a better word, the big pharmaceutical companies are usually take a pretty good beating, generally speaking,
right,
from both political parties,
Yeah.
depending on the issue and all that. And you have an observation giving some credit their way for their handling of what they were able to do in virtually no time at all.
Yeah, and I think you reminded me of another important point. Our frontline workers, healthcare workers, doctors, nurses, EMTs,
Saints.
Hats off to them. Yeah, exactly. And they were the very first ones to go in, figuratively speaking. But our drug companies, and I'm a little bit sad because I just know that very soon they'll become the targets.
Right.
Again, and we hear it already. The big corporations, the Wall Street, but drug companies are big corporations.
Sure.
Their stocks are traded on Wall Street, and I can't think of any government agency here or abroad that would have been able to pivot and would have had not just the capital, but the resources, the expertise, the corporate knowledge to
The infrastructure.
to turn on a moment's notice and develop the vaccine as quickly as they did. And
It was under a year. About 9 months, really.
And I can't think of in my lifetime where such a crisis was met so quickly and effectively as the drug companies did with COVID. But I think that's another one of those important lessons that we need to capture in this whole COVID thing.
All right. And since we had a long first segment and our time would grow short for this one, there are probably 4 more things I'd like to talk to you about or ask you your opinion on. But I think the most important one, we alluded to it earlier, is, and I think people are wanting to hear something on this, where do we go from here?
Yeah, great question. And so remember what I said before, I don't know. Now, I have an opinion about where I think we should go from here.
Right.
I will state for the record, I've been vaccinated, my wife's been vaccinated. I support people getting the vaccine, especially if you're at risk, overweight, elderly, if you're immune compromised. But it's also, I think, an individual choice.
Right.
The other thing that we have to remind ourselves of is this isn't going to go away. So where does it end? Does it end up being a dumbed down version of the flu? Will we soon be getting a routine vaccination every fall like we do for the flu shot, or it'll be an all-in-one shot that most people will get? And we all know the statistics on flu shots and how many people get it, and I think it's maybe 45%. There's plenty of people who don't get flu shots who I think should, and again, I'm a believer in the flu shot. Of course, for 20 years I had no choice in the military. You just got it.
You got it.
And smiled, But I hope where we go is back to that restoration of faith in our scientific community. Right. And if there's one lesson I hope that gets captured by everyone, and I have plenty of friends who are politicians on both sides of the aisle, but stick to your knitting, respectfully, stay in your lane, let the science to the experts. And I know many folks have invoked science, but I can tell you, there's still a lot we don't know, and so one of the
There's variants we haven't even talked about.
And one of the other hats I wear, I'm an associate editor for a journal It's called the International Journal of Health Planning and Management. And so now you see the shift in the articles coming in. And maybe 6 months ago, every 10th, 15th article would be on COVID. Now I swear 80% of the articles coming in over the transom are COVID this, COVID
sure,
that.
sure.
And you read them and, well, he says left, he says right, she says it's in the middle. Well, what do you believe? I don't know.
Which gets back to, I think, profound, what you said earlier, is trusting people to make their own decision. You know, for example, you raised the point of the vaccine, and as I told you off air, I'm not getting it.
Yeah.
And I say that with great respect for most people. I think the majority probably should, because if you're in a high-risk category, as I said, I do a kind of analysis, and I determine, look, COVID is a risk, and I evaluate it based on that, and I look at the vaccine, and then you factor in if you're in a high-risk category, and if you don't check, there's so many boxes: elderly, poor immune systems, diabetes, receiving or having received cancer treatments. Other ways that physiology, obesity is a big target. If you
smokers.
have respiratory issues, COPD, you should be first in line. And if I had any of those ailments, I'd be getting the shot. So I'm not an anti-shot person per se.
Yeah, no, I get it.
But for me, back to where we said, it's a personal choice. I'm lucky I have a great immune system. I'm pretty sure I'm not a masker, so I do the bare minimum as far as masking. And am responsible. But having said that, as you said, I went through this year. I'm pretty sure I had it, and it was so mild I can't say for certain that I had it. I think I had it. Didn't slow me down. I didn't miss a day of work or anything else and the like. So I'm lucky that I have an immune system, and I guess my philosophy is basically, if it's not broke, don't fix it. So for me, and that's, I guess, one of the points of the arguments, because still a lot of percentage of people are concerned about getting it.
Right.
One of the arguments is, for me, I think the greater risk is, since we haven't had 5 to 7 years of clinical studies like you'd like to have, we've had to take the chance, and it's been done responsibly by the drug companies, like you say, but my feeling is that I may be at greater risk getting the shot than I am not at this point in time.
Yeah, and we may be kind of leapfrogging for years as the virus mutates. And oh, by the way, so I've been vaccinated. Well, how long is it going to last? Again, I don't know. I know this: it won't last forever. And I hope and pray that as COVID mutates and changes, that they're right behind us with the new and improved version of the vaccine.
Sure.
But we may have to live with it for a long, long time. But I also do know this: we can't continue to live with it the way we have. The kids, we're talking about the COVID gap in education at all levels,
right.
Kindergarten through college. I've had a whole semester of all my classes online. We're all doing the best we can, myself included. Is the level of achievement the same as it were brick and mortar? I hope so.
Right.
I'll give a qualified I hope so. I'll say that we are all trying very hard. My kids, my students are trying very hard, but it's just not the same.
Right.
The other thing about our health and quality of life, another article I was reading, and the one thing you can't do under this lockdown is human contact. You mentioned nursing homes. My mother passed away in a nursing home.
Sorry.
The last 3 months, she was alone. So I could not be with her. And it is what it is. But that human contact and the price, the lack of that human contact, what's the price of that? I alluded to some long-term effects. There's scientific studies, and these I do believe, and I've read several of them. When a newborn is born, they make a point, skin-to-skin contact. And they've done studies that shows those infants, all other things being equal, do better than an infant that hasn't had that initial skin-to-skin contact. Right. So there's so many things that maybe aren't in the forefront of our mind that we should be mindful of.
Right. Unfortunately, Doctor, on that point, we're going to have to end.
Well, it's been a pleasure.
And I'd like to go, we can go another half hour without taking a break.
Yeah, but I appreciate the time.
And I appreciate your expertise for our viewership on this show. Thanks so much. We'll have you on again. As we get more hindsight, it's always 2020, right?
Okay, yeah.
Again, we're here today with Dr. Justin Matus, an expert on the matters that we discussed today. You heard many of his thoughts and opinions, some of which he's certain of, some of which he properly said, and I agree, we can't know for sure. But hopefully it was educational, and we tried to do that on this show. We'll be back next week at 11:30.